Thank you so much, and good morning, everybody. My name is Steve Hernandez, and I am the chair of the Strategy Committee. And this is a special meeting of the committee, Friday, April 11th at 10:15 a.m. I would like to note that we request that you introduce yourselves every time you speak. Roll call will be taken for every action. This meeting is being recorded, as you heard, for minute-taking purposes, as well as posting the recording of the proceedings on our agency website. This meeting is also live streamed on the Access Health Connecticut website. And good. So if Marcin, if we could have a roll call attendance to determine a quorum, please.
Yes, Mr. Chair, Steven Hernandez, Chair.
Present.
Grant Ritter. Paul Philpott. Paul Lombardo. You're on, thank you. Matthew Brockman and Kathleen Holt.
Here.
Thank you. And yes, we do have a quorum, Mr. Chair.
Thank you so much. And could we have the members of the Access Health senior leadership staff also introduce themselves?
Hi, Gina Walsh, Director of Operations, Access Health CT.
Hi, good morning. Rebecca McClear, Director of Technical Operations and Analytics, Access Health CT.
Good morning, everybody. John Carbone, Director of Small Group Product Development and Broker Support.
Good morning, everybody. Susan Ridgeby, Director of Legal and Governmental Affairs, Access Health Connecticut.
Good morning, everyone. Glenn Jurgen, Director of Human Resources, Access Health CT.
Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach, Access Health CT.
Good morning, everyone. I apologize. I couldn't get my camera and mic on before. Holly Zwick, Director of Finance, Access Health CT.
Good morning, everyone. Marquise Davis, Director of IT for Access Health CT.
Great. Thank you, everyone, for introducing yourselves. And Marcin, was there any public comment submitted or available for us today for our meeting?
There was no public comment submitted today, Mr. Chair.
Great, thank you. So if it please everyone, if we could please entertain a motion to approve the November 14th, 2024 Strategy Committee regular meeting minutes. Could we have a motion?
I'll make that motion, Kathy Holt.
Thank you, Kathy. And do I hear a second?
Paul Lombardo.
Oh, thank you, Paul. Great. Could we have a roll call on? First of all, is there any discussion on the motion? Any changes, additions? Hearing none. Marcin, if we could have a roll call, please, on the motion.
Steven Hernandez.
Yes.
Grant Ritter. Paul Philpott. Paul Lombardo. Paul Lombardo, affirmative, right? Okay.
Yes.
Thank you. Matthew Brockman and Kathleen Holt.
Yes.
Thank you.
Thank you. Thank you so much. And now, of course, the most robust part of the meeting, we have our strategic project updates. If you would, I think we have our Marquez Davis is going to be presenting first. Is that right?
That's correct.
Oh, great. Thank you. Floor is yours.
Thank you. Good morning, everyone. I'm Marquise Davis, Director of IT for Access Health CT. I'd like to provide an update for the 10 Clicks project that we have going on. We've completed the process of identifying and hiring an RFP writer. This individual will play a critical role in drafting and managing the RFP process to ensure that we clearly articulate our needs and expectation to potential vendors. The RFP efforts will ensure that we structure a procurement process that minimizes risk, promotes transparency, and identifies a vendor capable of delivering a robust enrollment system that aligns with the needs for the organization. The steering committee has been working really hard and diligently over the last few weeks to finalize this process, and we've just completed that process within the last few days. In regards to our tactical blocks, the team has been working hard for the last several months, finalizing the proposed changes. We have a targeted completion for all those team members to have their recommendations to us by April 26th. These blocks include, as I mentioned during our last meeting, key improvements such as user enhancement experiences, standardizing language, improving notices and communication, streamlining verification process, refining plan comparison, and coordinating with external partners. Once finalized, these updates will serve as the foundation for our new enrollment system and assist with the drafting of the RFP. Lastly, we plan to hit all these milestones, finally submitting the RFP by the end of this year. This milestone, along with the others, will mark a major step forward in identifying the right partner to help us implement and modernize our current enrollment system. This submission will reflect feedback from stakeholders and align with our project goals. We understand, again, these are major and ambitious achievements, but with the dedication of the steering committee and staff from Access Health, we're confident by hitting these targets, and we'll set ourselves up for success in delivering a streamlined, user-friendly enrollment system that will meet the needs of the residents of Connecticut. Thank you.
That's great. Thank you. Are there any questions or comments on the update?
I'm sorry, I'm looking for my hand. I have a quick question. When do
go
we
ahead.
expect this to go live for consumers?
We're hoping, we don't have a specific date, but we're thinking within the next 24 months, so next 2 years.
Thank you.
Thank you for that. Any other questions? That's exciting. Looking forward to the rollout and to continued updates as we get closer to those 24 months. So thank you so much.
Thank you.
Next, we have Gina Walsh for our call center update.
Thank you. Good morning, everyone. I'm Gina Walsh, the Director of Operations here at Access Health. I'll be giving the update for our call center activities. So back in February, Access Health awarded the call center services contract to T-Tech Government Solutions, who was our incumbent vendor. There was about a 2.5% reduction in rates through this request for proposal process, so we were very happy about that. T-Tech committed for no charge to be included to providing some additional enhancements, and we have begun to work with them to scope out that timeline, resources, and changes to complete these initiatives before next open enrollment. And just to touch on a few of the IVR ones, we'll be implementing a speech-enabled interactive voice response, which is the IVR system. We're going to start with English and Spanish, which are currently in our IVR, but we do have the opportunity to add additional languages at any time. So excited about that for future. We do track, what our top languages are each month. So if we find that we can add additional languages to help consumers that are calling in, we definitely want to do that. Second, we do have 3 currently informational messages in our IVR that educate our consumers on a few different items. One is that they could always use our website online if they choose, just in case someone wasn't aware. One that's really important is what pieces of information they'll need to enroll. So this is like a hold message. So it tells them if they are holding, what pieces of information, if they're enrolling new or renewing, that they'll need to provide to the agent when they answer the phone. And then we do, there is some confusion with consumers. They're not quite sure who to call on the Husky side. So sometimes they'll call us for SNAP or Husky C benefits. So it does tell them, they should be contacting a different number and what that number is. And with the new IVR, they'll be able to push a button and it'll transfer them over too. So we're looking to add additional messaging. We're working with our call center vendor right now to figure out, what those top calls are that we could educate consumers better with. We're also want to introduce a text-to-link feature in the IVR so consumers can choose. Again, it would be a choice. They're not forced to do this to receive text message links on different, top calls that we get. And again, it could be those informational messages I just talked about. It could be other stuff that are linked in our website. So, documents need to enroll, verification documents, and any other top call drivers that we see that will be coming through. So very excited about that feature and hope our consumers will decide to use it. Lastly, we want to add auto authentication functionality within the IVR. So, right now when you call in, an agent spends probably about 3 to 4 minutes authenticating a consumer. It could be quicker, right? Sometimes it takes a little bit longer. But this part of it would already be done in the IVR. So working to see what that would look like and know that it will enhance the phone call when a consumer calls in and their consumer experience, because they'll be providing less of that information and really getting to the root of why they're calling, whether it's enrolled or having an issue or things like that. So very excited about the upcoming changes to our IVR, and I'll continue to update this group as we move forward. So thank you for giving me the time to share. And are there any questions for me?
That's great. Such a vital element of our communications and service infrastructure. So we appreciate the update and thank you for all your work. Great. And next we have John Carbone.
Good morning, everybody. John Carbone, Director of Small Group Product Development and Broker Support. As many of you know, over the past 8 to 9 months, we've been working on developing a platform for our employers here in the state of Connecticut to provide them that look and feel of a group option, but be able to come into the individual market and be able to shop and meet all the ACA requirements and CMS requirements. We have about 84 days left to our launch, and I'd like to inform everybody we are on track. We've been working with our carrier partners on the Connecticut side and the Anthem side, and also been working with our brokers, our local brokers. We currently have about 15 brokers in the hopper that are continuously doing testing. To give a little overview, we've revamped the technology site over 7 different times going through all this feedback. And the reason why we've done that is we want to make sure that the feedback we're receiving from our brokers allow those brokers to enroll those employers as smoothly, as fastly as they can. So when the members do receive this information, they're educated on the process, they understand the system, they know where to find the information, they can hunt and search for plans effectively and quickly and make good decisions on deductible plans versus co-payment plans versus different types of options, and be able to look at them and compare them side by side. We're really excited in the direction we're heading in because we feel like we have simplified the process for these brokers and employers and kind of cut the time of enrollment down for them. And we are developing and enhancing a lot of different types of quoting styles that the IRS allows us to do in different types of classes to streamline and eliminate some of the complexity in there. So in the next probably month and a half, we'll be fine-tuning and testing and cleaning up and probably stopping any technology releases after that to make sure we have all the branding and everything squared away and all the information into the platform. But we have started our marketing campaigns that have some of you may have seen, but it is going to be ramped up over the next week, which are going to be billboards, streamline ads regarding in Roku and different types of streaming apps. Also, we're in the Hartford Business Journal, New Haven Business Journal, because our focus at the moment is brokers and employers. We are kind of focusing on the segment of not-for-profits, and we're starting to reach out to them to provide that information through their brokers, and our marketing materials are being completed. So stay tuned. We will share all that stuff with you. We're also going to be doing in-person broker training, and that training is going to be anywhere from 3 to 4 hours. We're also doing staff training here at Access Health, and we're going to be doing that over the next 4 to 6 weeks to get everybody up to speed. Most of the weight of this burden is going to be picked up on the broker, employer, and employee. So that's why we feel like that external team that we have here at Access Health needs to be up to date, needs to be that SHME and be able to hit the ground running and make those decisions with those brokers and guide those brokers and employers through the process. We have seen some exciting numbers on some preliminary updates that we've gotten for some groups, and we're working on them. We've seen anywhere from an 18% decrease in some small group rates to as high as over 35% for some groups over 75 employees in. So we're continuing to move that. Are we saying this is going to be the silver bullet for everybody? No, but this tool does give you the options to be much more creative as an employer and look at all the options from small group to a NICR contribution concept or just straight individual plan, go through the exchange and give them those options in one area they can look at it. On top of that, also too, we're going to be doing NABIP training as an association, National Brokers and Insurance Professionals. We're going to be doing a session with them that is also going to be about 4 or 5 hours, and we're going to be meeting with other associations throughout the state of Connecticut. And also too, on May 20th, we're going to have our Small Business Summit at Sheridan and Rocky Hill. Stay tuned. We are going to be doing a quick news, a press release on that, and we are going to share some additional information. We'll be reaching out to some of you who have participated and see if you'd like to participate again this year. But if anybody has any questions, please don't hesitate. Just to end, as we get our marketing stuff completed and all our brochures completed, we are going to start sending them out to all the committees and all that. And if you have any questions regarding anything you see in those, please don't hesitate to reach out or ask us any questions. So if anybody has any questions, please let me know.
Great. Thank you, John. Seeing no other questions, thank you for that robust update and looking forward to all of that, especially that convening. So let's see. I think we certainly, last but not least, we have not yet. No, we have Tammy Hendricks, Broker Academy. Hi, Tammy.
Hi, thank you. Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach. I have some updates for the Broker Academy Year 4. So excited. We are charging full steam ahead, currently in the application review phase. And I do apologize. We've had some updates since submitting these slides. So I will get this slide re-updated for you by the end of this meeting. So starting with the application, we extended the application deadline this year, as we've done in previous years, to accommodate some last-minute applicants. And there's a great story behind that. In our first year, the very last applicant that we got for our first year program is now the highest performing broker of all of the classes so far, and dare say he is up there with the other brokers as well. So really excited about that. So it's like our little tradition. We do extend the deadline out just maybe about a week or two. So we officially closed the application this week, bringing our total to 109 applicants, right? We exceeded last year's number. And this was a shorter application period compared to last year as well. And you can see that huge jump in the website visits from February going into March. So really good batch of applicants there. And so some of these stats will need some updating. They won't be very far off, but based on the 95 applications that we received on March 31st, the applicants were from 43 different towns. That was an increase that we've seen this year as well. The class, again, majority identified as female. This is an ongoing trend for this program. Something certainly we do not plan for or arrange. It's just happened this way over the years. And for this year, there's a slight shift with 30% identifying as Hispanic Latino, followed by African American and non-Hispanic Latino. So a little shift there. Typically, it's the opposite. So we're happy to see the progression, some shifts. And for the two classes, we'll have two class locations this year. They will be in Danbury and New Britain. Our community partners, CT Leads, has generously offered their locations to us to host our classes at no cost, and we are so grateful for that. And finally, the class days are June 7th and 8th. I'm sorry, I mistakenly put the first year's class date on this slide. So this year it will be on the weekend, which is a huge shift for us. accommodating those who work typically during the week, struggled in previous years, taking days off. So we are going to do this year's class on a weekend, and students will have more access to the learning portal. We're uploading more resources, and we'll have more meetings throughout the month of May to get them prepared. And this decision was made after speaking with Kaplan, making sure that they will have all the trainings and updates that they will need. And so we decided after all of that, we can reduce the mandatory in-person days to 2 days. So we're happy to make that shift. And I think a lot of the students appreciate that as well. Getting childcare, transportation, not having to take as many days off of work has been very helpful from the applicants that we've heard so far. So the students will be better prepared going into those days. And we're really excited for year 4. And I will open it up for any questions.
That's great, and congratulations on the enrollment. Congratulations on this amazing program, and we just love hearing these updates every time, and how it is that you're expanding your reach, but also that you're being very intentional about finding more ways to more deeply impact communities. So thank you so much.
And thank you for all of your support. Obviously, this work wouldn't have been, we wouldn't have been able to do this work without a very committed board and strategy committee. So thank you so much.
Thank you. Next, we have Susan Richby. I don't see you, Susan. There you are.
Yep, there I am. Sorry.
Yep.
Thank you, Martin, if you go. Thank you. So we just wanted to provide you with a brief update on the Connecticut Molina merger. On February 1st, Molina Healthcare finalized its acquisition of Connecticut Holdings, Inc. And we have been told, working with Connecticut, that they will continue to use the brand names Connecticut Benefits, Inc. and Connecticut Insurance Company, Inc. For the products that are offered through the exchange, which is good news. You know, less consumer confusion there. Molina is new to the Connecticut market. They are in some exchanges. I think we've presented information before across the country. They're very big in the Medicaid managed care space, but also in some health insurance markets across the country, SBM. So they are new to Connecticut. So we hope they like what they see here. And we continue to work with them, you know, for 2026. So I'll pause if anybody has any questions. Okay, thank you.
Great. Great. Thank you so much, Susan. And let's see where we are. I think we are now, do we have one more update here? I'm trying to find our agenda.
Good morning, Mr. Chairman.
Oh, good morning. Yes, of course.
Good morning. My apologies for my tardiness.
That's okay. I found it.
I've been traveling, just got in late, early this morning. I got in. Very quickly, we've been working diligently across the country with my colleagues in preparing for the possible expiration of the enhanced subsidies that came in through when Joe Biden was president. During COVID, he enacted 2 bills with Congress that gave additional subsidy to recipients of advanced premium tax credits, and also removed the 400% threshold. That anyone above 400% of the FPL, federal poverty level, did not qualify for any subsidy at all, and that really made removal of that made health insurance in Connecticut more affordable for many Connecticut residents. So that is scheduled to expire at the end of this year, December 31st, 2025, unless Congress acts. So we've done a number of outreach across the state of Connecticut. We've been communicating this with all of our elected leaders, with the governor, with the 7 members in DC that represents Connecticut, the 5 reps and the 2 senators. So they're fully engaged, fully aware. We're very fortunate that we have a very dedicated congressional folks who are focused on making sure this this act gets renewed. But they can't do it they cannot do it alone. So what we've been doing, we've been giving them information for them to use in Connecticut as well as outside of the country. So to make this happen, if this does not happen, we will go back to how it was before these acts took place, and which will make the health insurance a little bit more expensive for Connecticut residents, and also a lot of folks will lose coverage, especially those who are at the 400% of FPL and above. There will not, many of them we anticipate will not buy health insurance. It'll simply be too expensive for them. For some of them, the premium could go up as high as between $2,000 and $3,000 a month, while they're currently paying between $300 and $400 a month for them and their families. We know that's not affordable for most Connecticut residents. So we will keep you. We just want to make sure that the strategy committee is aware that this is coming. We are working hard to communicate this effectively across the entire state, as well as working with my colleagues across the country for them to develop strategies to get their congressional folks to support the extension of this bill. This concludes my very brief update on where we are with the possible HIT subsidies change that may impact Connecticut residents.
Thank you so much. And, this is one of those potentially very difficult and dire consequences of federal action or inaction. So we appreciate the update. And I also really would appreciate understanding how deep this impact is going to be when it happens, and how it is that we can address it, at least as a state. I know that the states are working together, but it'll be interesting to see what it is that we can come up with. But thank you, James.
You're welcome, Mr. Chairman.
Anything else for the good of the order today?
I think this concludes our presentation this morning.
Great. Thank you, James, to you and your team for all of your hard work. And I will note that our next meeting is on June 12th, 2025. So with that, Marcy, I would wonder if we could entertain a motion to adjourn. Motion to adjourn.
Lombardo moved.
Thank you, Paul.
Kathy Holt, second.
Thank you so much. Could we have a roll call, Marcy?
Steven Hernandez,
Yes.
Ron Ritter, Paul Philpott, Paul Lombardo, Matthew Brockman, and Kathleen Holt.
Yes.
Thank you.
Thank you all. Have a wonderful day. Thanks for the updates.